people in here at the moment, so let's just jump in. Hi, everybody. Thank you so much for joining us today for what I know is a hugely important conversation to state legislators across the country. The fentanyl epidemic is ravaging the country from big cities to rural communities, and every state legislator in America is trying to find a solution. So today we're going to get a 360-degree view of what's really happening from the local perspective, from the state perspective, and from a federal angle too. I'm thrilled to be joined by four people who are really leading and thinking about ways to address the fentanyl crisis. And we're going to talk to we're going to kick off with a panel of two of them right now. First of all, New Hampshire Governor Chris Sununu and former North Dakota Senator Heidi Heitkamp. Governor Sununu is coming to the end of his fourth term in office, during which he spearheaded programs that became national models for prevention, treatment, and recovery from substance abuse disorders. And Senator Heitkamp has two great perspectives on combating addiction, first from her tenure as North Dakota's 28th Attorney General, and then during her time in the U.S. Senate. So welcome to both of you. I wanted to keep those bios brief because I think most people know you. But Governor Sununu, let me start with those models that I mentioned. Tell us about the Doorways program that you launched in 2019.
Yeah, so I mean, just as a little background, I think as a lot of folks know, New Hampshire's really been at the forefront of the crisis, right? And we had one of the, I think, the second highest overdose death rate in the country back in 2017. And really simply, they were kind of piling money into the old system, dealing with treatment and recovery and even prevention. This was all stuff that was designed in the 70s and 80s, and frankly, designed pretty badly at that. It was not designed for fentanyl. And whether you're talking about alcoholism or fentanyl, marijuana, all the different aspects, and now it's even transformed into tranq and xylazine and all these other pieces to it. It was a very old system, and all the services were in the city, which is, the sense was, oh well, the city of Manchester is your biggest city. That's where your big problem is. Very quickly, we found out that the addiction rates in rural parts of the state, rural northern New Hampshire, were 4 times that of the city, but there were no services, right? Because there's no access. So we realized the crisis was really about not just what services were being provided, but the access to those services. No one's going to get in the car and drive 150 miles for a treatment center, right? They're just going to kind of tough out their addiction. So as we went forward, we would work with those same nonprofits, but would say, we're going to do more of a hub and spoke model. We're going to create centralized access points across the state. We did 9 of them. We're going to attach them to hospitals, make hospitals more accountable to this system. I mean, one thing we found is when people came in, if they had overdosed, they'd be in a hospital by 3 a.m., they might be recovering. They got fentanyl, they got, some of the recovery drugs and everything. And then all of a sudden they were just walking out the door, and the doctor would say, hey, you should go to this recovery center at some point. Hope you give them a call. And it was goodbye and good luck. And so what we found is you really need that warm handoff. So by attaching what we call our doorways, our hubs, if you will, 9 hubs across the state that have fully wraparound services, whether it's treatment, multiple choices of recovery programs, housing initiatives, but it's all wrapped around that hub that's now attached to a hospital. And so we've actually kind of forced the nonprofits to take this new model and say, well, we'll keep providing some funding, but you've got to provide access in these rural areas with this new system. There was a lot of pushback. I mean, a lot of pushback on it, to be sure. But a hub and spoke system, and there's various forms of this across the country, is really the way to ensure that these access points are being met. So, I mean, that's really at the heart of it. And, to the credit of the former Trump administration, they were very aggressive about, giving us funding to try this new model. And really, that's where a lot of the SOR grant money came from. Mm-hmm. All states get SOR grant money. There's a big influx that started around in 2018, 2019. And we use that money to kind of spearhead the infrastructure needed in this. The last piece I'm going to throw at you, and I don't mean to talk too long, closed loop referral. It's absolutely imperative, meaning if you're in one part of the state with going in an addiction program here, because you move to another part of the state doesn't mean you should fall out of the system, right? You should get a kind of that warm handoff, or a referral to either a different treatment program, another recovery program, or maybe find another program that just wasn't working for you. But it's all going to be a warm handoff within a closed loop system. Otherwise, you lose these individuals, and I call it sending them back to the wolves, right? They kind of go back to their old bad habits in systems and organizations that aren't providing appropriate support. And then you build all your we've experimented with some additional support system, recovery friendly workplaces and other things like that around that. But that's really at the heart of the whiteboarding we did. It wasn't just all in Manchester. It wasn't the old way of doing things. It was rural access to care with a kind of a more modern outlook and being very results and data driven. Too many people try to take credit because, we provided money over here. Well, who cares? What result did you get? Were less people dying? Were there less over? Like, you got to get a result here, folks, before you start taking credit for bragging about the dollars you put in. So we did put a lot of new dollars in. And since 2017, our addiction numbers, our addiction deaths at least, have gone down. Like, the rest of the country's, gone up. South Dakota's been a huge, another huge winning state on this, I think, which is tremendous. But boy, there's so many states out there where you're seeing the numbers continue to skyrocket. We're still going to lose probably 400 people this year. That's a lot for New Hampshire. 400 people will probably be lost to the fentanyl crisis and the drug overdose crisis this year. But it used to be closer to 500, and now we're on a downward trend. So we're heading in the right direction, bucking that national trend, but definitely still a lot of work to do.
Yeah, I want to come back to that recovery-friendly workplaces program in a minute, but Senator Heitkamp, let me bring you in. Let's start with your state-level experience combating substance abuse. I think when most people think of attorneys general, they think of prosecutors, but you ran the drug enforcement programs in North Dakota. I mean, can you talk a little bit about sort of the balance there between prosecution and alternative options like treatments?
It was so interesting because when I first became Attorney General, which was in 1992, yes, I'm very old. The model really was law enforcement driven. It was, get these people in jail. All of them don't belong there. If you want to fix this problem, you've got to criminalize it. And obviously, that did not have the results, as the governor's talking about. You gotta look at the results. It did not have the results that people were anticipating, and we saw an increased rate in utilization. Whether at the time it really was a growth in methamphetamines and utilization of methamphetamines, kind of winding up into prescription drugs. And when you look at North Dakota is a very small state, right? And so I think people had this expectation, again, as the governor said, this is just a big city problem. In our case, Fargo, Grand Forks, it's a minority problem. It's not, it's being driven by people coming in from the outside, only to discover that wasn't in fact the case. And so during my time in those 8 years as Attorney General, we started introducing things like drug courts. We started talking about, you cannot do this with law enforcement alone. You cannot supply side your way out of this problem by simply trying to curtail the supply. It's an important part of kind of all the tools in the toolbox, all hands on deck to get it done. But the bottom line is that I think there was a lot of rethinking during that period of time. How do you deal with this? And the one thing that those of us who have been in this business for a long time know that the co-location in people's kind of belief systems and how they live their lives. A lot of this addiction is being driven by mental health challenges that are going undetected, that are going undiagnosed and untreated. A lot of it is really related to what I would call early childhood trauma, where if we addressed early childhood trauma, we might lower the rates of addiction early on. And so I think we're looking at both ends. And that during the time I was Attorney General, my line was, you cannot supply side. I cannot stop the flow of drugs enough to prevent overdose deaths, to prevent crime that comes with the introduction of these substances into communities. We absolutely need to have a better, more a broader analysis of this, and we need to look at it from a mental healthcare perspective, and that's why the work that the governor is doing is so critical. But it's all hands on deck, all the tools in the toolbox that need to be kind of utilized in order for society to address this scourge.
Yeah. I want to talk about one of those tools in the toolbox, the opioid reversal medications, or overdose reversal more broadly than just focused on opioids. A lot of states have adopted these, and I feel like I've seen some pushback from legislators who are still wedded to that old model that you talked about, Senator Heitkamp, of sort of punishment first, if you will. So, Governor, Sununu, can you talk a little bit about your experience? I mean, did you encounter resistance from lawmakers or the public in your push to make these reversal drugs more available?
No, I can tell you, the crisis had hit such a level by the time I had become governor. It was the #1 issue in the state. I mean, it had happened just so abruptly in a period of about 3 years. Everything just skyrocketed. So the fact that there was such great public awareness, it really cleared a path for us to be, I don't want to say pushy, but to really say, look, this is where we need to go. And it kind of forced people out of out of some old school thinking. I think it's very different in other states. I'm not saying we're better or not. If anything, just the crisis hit harder earlier here. And so that gave me the ability. So when for example, when we went hard on Narcan, we didn't say, hey, we're going to invest in Narcan and make it available. We made sure it was in the prisons, it's in the schools, it's in the community centers, it's everywhere, because what we tried to emphasize with folks is there's no place in the state, there's no demographic, there's no income level, there's no race, this crisis is completely blind to those issues, and everyone needs to be prepared. And the first and foremost challenge is making sure we save a life. And when we can save a life in the moment, we can then immediately move them to a doorway, the hub and spoke system that can save them for a lifetime, and put all the support systems in there. So we had a lot of buy-off, and I think with it by about 2018, we had far more Narcan across our state, as just, and there's a couple different forms of that now, but at the time it was all about Narcan. We did things like making sure, for a while we found out that if you were in law enforcement, you weren't allowed to administer Narcan unless you got a certain amount of training and all that sort of thing. Otherwise, they would be held accountable in terms of they could be held liable if something went wrong. And we kind of gave them immunity around that to make sure that, look, if a police officer, a firefighter, someone is first on the scene and willing to administer Narcan, they shouldn't hesitate. And if you do that and you do it in the right amount of time, it can be absolutely life-saving. So there were some policy barriers that had to go along with that. But our Narcan buys were very high, very aggressive early on. We got a lot of other folks, and it's really everywhere at this point. I mean, people just keep it in their cars. I mean, that's just it. They're not addicts. They're just people that are in areas or around populations that they know at any moment could need Narcan, and it's so super easy to administer. That's the other amazing part about it. It's a very simple thing to administer to save a life. And then when you have the system there. So no, we didn't get much pushback from the legislature, and because we have gotten results, that's been one of the easiest parts of this in terms of and it's affordable, right? I mean, you can get it actually, quite inexpensive, and we buy so much of it. We always want the best price, but we buy so much of it that it's there. But I think the most important aspect, if I may, is don't let any school tell you they don't have a problem. Don't let any community tell you they don't have a problem. Don't let anyone tell you that they don't need it. Even if they know they need it, sometimes they'll say they don't because they don't want folks to, I had principals tell me that they didn't have that kind of problem in their school. And I went, that's nuts, man. Either you really don't know that it's there, or you're just telling me what you think everybody wants to hear because you don't have a solution. We're not asking folks to provide a solution, but we are asking them to understand their role and what could happen in a life-saving situation. So, I'll add one more piece. As I go to, I talked to a lot of other governors over the past 8 years. It was amazing to me. I mean, in like 2019, 2020, governors would come up to me and be like, this fentanyl thing is pretty serious. And I'm like, oh my God, like, holy cow. There were some states that were so far behind. I won't throw names out, but they were so far behind in understanding the seriousness of this, what it is. And we'd provide all the assistance that we could in terms of Narcan and what it was. But I cannot totally understand why those legislatures, some of those policymakers would have hesitancy over bringing in, large amounts of this drug, because if you don't really appreciate the situation and you don't have the public driving the policymakers there, I do understand why there could be a barrier.
No.
If I could just add to that, you got to look at both ends. We've got harm reduction, which is really this tool of reversing the addiction and reversing the overdose. Critically important. There's other kinds of mechanisms in harm reduction. And I think for a lot of, I still talk to a lot of the guys that I worked with, mainly guys in drug enforcement, and it's taken them a while to get to, that point where we have to provide this if we're going to save lives. But understand this, we also have to begin to address medically assisted treatment for addicts. And so much of the resistance in the past has been, oh, that'll just perpetuate this. It needs to be zero tolerance. I met a young man in Minot, North Dakota, who was able to travel the country. He was only there because Minot provided a medically assisted treatment center, and he could come and work on the windmills, erecting windmills miles for wind power, and because he had that resource available to him. And so if we are going to provide an opportunity for people who are addicted to achieve recovery, again, we can't be judgmental about how they do it. And we've got to begin to really look at evidence-based treatment, a lot of which is medically assisted treatment.
Yeah, yeah. We're running a little bit short of time here. So Governor Sununu, I want to return to the drug-free workplace, recovery-friendly workplace, excuse me, program. Tell us a little bit about that. That's a really interesting sort of buffer that.
Yeah. So look, before I was governor, this happened. I ran a ski resort. We're up in the mountains. I got 800 employees, and I had people that were addicted to X, Y, and Z. And what I found was we didn't have we didn't have rural access to treatment. If someone was addicted, I could fire them, but then they lose their self-worth. They're kind of sent back it's a loss for me because I lose a good employee. It's a loss for them because they have no support system. So I just created something within my workplace where I said, look, if you're dealing with addiction, just come talk to us. You're not getting fired. And we basically started with a peer-to-peer group. I had Bill over here who's a recovering alcoholic, and you're going to keep an eye on Steve over here who's a fentanyl. So we were just piecing it together as best we could. But we came recovery. I realized we effectively became recovery friendly, right? We wanted folks to embrace it. So I become governor, and I said, maybe there's some businesses that would be interested in this idea. We put out this model. In very short order, we had well over 100,000 employees working for what we certify as now a recovery-friendly workplace. And we do it real simple. It is like literally 5 check boxes. And all that's basically happening is we're going out working with the businesses saying, look, HR department or whoever it is, if someone comes to you and talks about addiction, do you know the treatment centers and the recovery centers? Do you know how to talk to them about it? Do you know what might be available? How do we help you as a business help your employee because, remain employed, because staying employed is such a huge part of recovery. It's such a huge part of the process. What we found almost right away was all of a sudden we looked at the data, people requesting placement at treatment centers and recovery centers skyrocketed. It went up literally 10 times in the state. And I went, oh my God, this thing is getting out of hand. But what we found was all of these people were now working for recovery-friendly workplaces, but they were no longer afraid of being fired. So they were finally going to get treatment, right? They weren't afraid of somebody seeing them walk through the door of a treatment center and then they lose their job. So having the workplace support you, keep an eye on you, make sure you're kind of on track with your program and the variety of different programs that could be there. You get to stay in your community. You don't lose your family. You don't lose your job. You don't lose the income stream. You don't lose all those things that keep real stability. And that's that's really the instability, the insecurity, the loneliness, the isolation. That's really what drives so many folks to either not seek further treatment or stay addicted. So we just found that it was a huge win, right? It was a huge win all around. And I started talking to a couple of the governors about it, this and that. Now it's in, I think, 35 to 40 states. And I think SAMHSA is looking at funding it nationally, which is great. So it's just a program where we are providing support to the business so they can provide it to their employee in a very simple way, very minimal bureaucracy. And then we follow up with each of those businesses. We retrain, we ask questions, we go through different processes. The other thing I want to add in is as fentanyl, fentanyl is obviously the driver here, but now we're mixing drugs. Now we have tranq, now we have xylazine, and we're going into those businesses and talking about what happens with those, because when those folks get addicted, it's very different. The recovery programs could be very different. The opportunities could be very different. So we're just really staying on top of those businesses, providing them the support they need to keep those folks employed. And it's been it's been a life changer. So we don't have nearly as many people on unemployment. We don't have nearly the addiction rate we used to. We don't have the death rate that we used to. And it's just a big piece of that puzzle. And when you go to one of those hubs to get treatment, when you come out of treatment, they'll say, hey, look, we can help you find a job. And look, we're going to find you a job with someone who is recovery friendly, right? So you don't have that stigma. So you don't have that fear. So you can, when you break down the stigmas, boom, it was a huge opportunity to open a lot of doors for a lot of folks.
Yeah. Senator Heitkamp, if there's a magic bullet to all this, what is it? Or is the problem that there is no one solution to this addiction crisis?
Well, anyone who thinks there's one solution hasn't been paying attention, and the governor is hitting on all of those pieces. But what I would add to this discussion is let's look at kind of who are the people who are more prone to addiction in your community. And we know from the research that's done on early childhood trauma and ACEs scores that if you have a higher ACEs score, which is adverse childhood experience score, you in fact will have a much higher propensity towards addiction. And so when we not just look at how are we going to treat the problem that we have today, which is critical for workforce development, which is critical for families, how do we not just look at treating the symptoms and trying to reverse the problem that we have today, but how do we work on addiction prevention? And what does that look like going forward? And those are the kinds of tricks. That's a long-term solution. Government's not particularly good at long-term solutions or making those investments on the front end. And I just want to say, we also have to develop workforce, addiction workforce. Let me tell you, I had a woman whose son was horribly addicted to fentanyl. She was convinced he was going to die. She's probably right. She came to my office when I was in the United States Senate, and she begged me to call the chief of police of Fargo Police Department to have him arrested and put in jail, because it was the only place she thought he could get treatment, because she had been trying. I had someone up in Williston, North Dakota, who had a boyfriend who was addicted to heroin. He came to the school counselor. It was a month before addiction counselors could see that person. And so we absolutely need to grow workforce. We need to be friendly in terms of reimbursement on how we deal with mental health and behavior health and addiction. We need a whole new structure. And so no one silver bullet, just smart people like this governor here, who from his standpoint as an employer saw the problem, saw it as a huge problem, and is circulating really good ideas. But it's not just the treatment of what we have right now. It's looking at addiction prevention for the future.
Yeah, yeah. And Governor Sununu, I'll throw the last one to you. You said in your State of the State address that there's more to be done in combating the crisis. What's on your agenda for your last year in office?
Yeah, so look, so what's on the agenda is kind of repeating a little bit what the senator just talked about. And I want to hit prevention. Look, the only way you solve any of this is prevention. Treatment, recovery, interdiction, arrestment, law enforcement, all important pieces, but that's all after the problem happened, right? So the only way you really get there is a huge driver on prevention. And it's not just prevention in schools. It's not just say no. We now call it no safe experience, because some people say, well, I'm just smoking marijuana. They're lacing fentanyl in with marijuana. They're lacing fentanyl into black market pills. They're lacing it into everything, knowing that they might kill someone, but they'll probably create 10 addicts at the same time. So this whole no safe experience prevention and messaging, not just in schools, but with adults as well. We have, like I said, there's a reason, and we can go into all the dynamics. Many came out of the book Dreamland that came out years ago about how fentanyl was really targeted at the suburban, affluent families and all of this, and how this all started. But the point in all that is, there's really no safe area. There has to be a prevention message, and it might be slightly different everywhere. So driving forward on providing those wraparound services, and also what the senator really hit on, workforce. You can have the best programs and all the money, and none of it means shit. Anything. It doesn't mean shit either. If you don't have people behind it, and if you need to show support of your system, you need to show support of those employees, you need to make sure they're not getting burnt out, to have those opportunities to retain workforce. And, we're surrounded by places in New Hampshire. We have Maine on one side, Vermont at the other, Massachusetts to the south. All of them we're all struggling with this in different ways. But boy, I feel it's tough in Maine and Vermont, because they're losing population, especially Vermont, unfortunately. They're losing social workers. They're losing MLADACs. And so that's a really, really big piece. So becoming a place that is affordable, where you have housing, because we're not paying these folks a whole lot, guys. These guys, if it's not affordable, as much as they might want to come to your state, they can't come to the state, right? So housing is actually a huge piece of this crisis, because without the housing, I don't have the employees, and without the employees, it falls apart. So you got to make sure all those other economic pieces are in place to have the to maintain the infrastructure around your investment.
Yeah. All right. New Hampshire Governor Chris Sununu and former North Dakota Senator Heidi Heitkamp, thank you both for spending time with us today. I really appreciate it.
Thank you.
All right. For our next panel, I want to turn to two people who have a much more local perspective on this crisis. I'm happy to welcome two guests who bring a perspective from very different parts of the country. First of all, we have Franklin County, Florida Sheriff A.J. Tony Smith. Sheriff Smith is serving his second term in office, capping a 40 years career in law enforcement. And we also welcome Lisa Bright, the chief executive of the Will Bright Foundation in Trussville, Alabama. The Will Bright Foundation helps those in recovery get a fresh start out of rehab. So welcome to you both.
Thank you. Glad to be here.
Sheriff Smith, let me start with you. Tell us about the situation on the ground in Franklin County and around Florida. What share of the crimes that your deputies are responding to involve drugs broadly and fentanyl specifically?
Well, I don't know whether y'all know or not, but we're a small panhandle county. We're up in the panhandle. We're probably the third smallest county in Florida. And we have a huge tourist population that comes here in the summer and spring, and actually turned into just about a year-round tourist destination. So that's helped stimulate our economy. But we still are a poor county. We're one of the fiscally constrained counties in Florida. There's about 20, and we're one of those. But I usually run a population of about 80 to 100 people in jail. And just about everybody in jail has a substance abuse issue, whether it's alcohol, opioids, fentanyl, meth. Meth has been the big drug here, but as you all know, it's laced with fentanyl and other things. So we are seeing fentanyl not as heavily as some of the other counties have, especially the bigger populations, I think, are seeing a lot more of it. But we do have it. I mean, we have pretty much a zero tolerance. If you have, a dirty spoon that has meth residue, you're going to go to jail. And we feel like it gives people a better opportunity to get clean if they detox in jail. A lot of them then do want to go to rehab, and we have what's called care coordinators on staff that their job is to work with everybody that comes into the jail and people on the outside that aren't in jail to help them find rehab, mental health counseling, or really just about any kind of issue they have in their life that's keeping them from being a productive part of the community.
Mm-hmm. Gotcha. We heard from Senator Heitkamp talking about the balance there between incarceration and treatment. Talk a little bit about sort of your approach, a zero tolerance approach. What are the benefits to that? What are the drawbacks?
Well, we have a zero tolerance for particularly meth, opioids, fentanyl, any of it. Any amount, if we catch you, you're going to go to jail. What happens when you get to jail is another story. If we find that you're a major trafficker with an extensive criminal history, then as far as I'm concerned, rehab is off the table. You can sit in jail, you can go to prison, you can get your rehab in prison or after prison. That's the way I feel about it. And if you're a user who's selling a little bit of dope to try to maintain his or her habit, and you don't have an extensive criminal record, then we're certainly open to putting you in rehab. And we have a lot of resources for rehab here. We actually just finished last year building an outpatient facility here. We're 80 miles from the nearest rehab. Our detox center is 80 miles away. So a lot of times when people are arrested, they wind up detoxing here. And of course, our medical team is used to that, and they handle that very well. But yeah, that's kind of how we look at it. And it's worked. We had a 1-year rehab program in the jail for a while that would prove not to be effective. So we actually just stopped it this year. We're now just getting ready to start a 8-week program so that people who are in shorter periods of time can be in some kind of treatment before they get out. Because they come, we may have somebody here for a year, or we may have them here for a week. It all depends on the charge, their history, and a lot of different factors. So we got to have kind of something that fits everybody. And so that's what we're trying to come up with. A year-long thing, just the success rate was almost zero. So we're just, looking at new techniques. And of course, we have multi-generations that are drug addicts, 5 generations of drug addicts in our community. I have 3 brothers in jail right now. I have mothers and daughters, fathers and sons, all this kind of stuff. And we have come to the conclusion that the only way to stop this cycle is to stop it at an early age. And we've tried to do more in the schools. We have a lot more to do, but we feel like that's a good place where we can stop it if we can get to those kids and give them hope you know, a lot of our people here, they're not educated. You know, we do assessments on everybody that comes in, and we see a lot of them don't have a high school education, and their parents didn't have high school educations, and that seems to be replicating. And so we do feel like, and I'm not a social worker by any means. I'm a cop, and but I do know that being a sheriff and running a jail and being in a small community, that we are social workers, and we do a lot of social work. We have a charity fund that builds wheelchair ramps for people. I mean, you name it, we do it. And so we try to show the compassionate part of law enforcement, but also know that we do have a zero tolerance for crime in our community. And so of these 80 people that are in jail, mostly substance abuse related, some of them, all of them, if it's not drugs they're caught for, then they're committing some crime that is the result of their addiction.
Lisa, let me bring you in here. The Will Bright Foundation, named for your son, specifically helps people coming out of rehab. When I think about the crisis, I think about prevention and treatment, but I mean, tell us about what people in recovery need after that treatment ends.
Yes, thank you for that. So my story is we lost our son to a heroin overdose in 2012. And the one area that he struggled the most with his walk in addiction was taking that next step. He could go through any recovery program, and he was in them from the state of Alabama to the state of California. And he could graduate. He would buckle down and be able to detox and get everything out of his system. But it was coming back. A lot of it was his age, but it was coming back and being able to take that next step. So after he passed away, we knew that we wanted to be able to do something. So we started our nonprofit. And what we specialize in at Restoration Springs, which is in rural West Alabama, Fayette, Alabama, we specialize in taking men. Currently, we hope to one day offer this same service to women, where they are coming out of recovery. They've got this nice piece of paper that said you graduated and you've done all the things that you're supposed to do. And then now what are you going to do? Chances are you've not participated in the workforce in years. You probably don't have a driver's license or social security card, which you have to have one or the other to get one or the other, which is kind of a defeated purpose. So what we offer at Restoration Springs are those next steps. So we house people. I think Governor Sununu talked specifically about workforce and housing. Those are two of the top things that we focus on getting our residents immediately involved in. But another part of it is transportation. So when you're in a rural part of the state like we are, there is no public transportation. So those are things that we offer that are such, can be such downfalls for someone that's coming out of recovery. They're feeling really good about themselves for the first time in a long time. And now what am I going to do? So we take them in, we do assessments on them. We provide very affordable housing. They do pay a small fee, but that's part of that accountability as well. We provide transportation to and from work. We find them jobs. We hone in on what their skill set might be. Our wraparound services include everything from community colleges to mental health services. Just the things that you're not going to get if you just go right back home, maybe to your mom and dad's house or to an old neighborhood that is probably not a really good place for you to be. And the funny thing that we found out, we're fairly young. We just opened Restoration Springs in 2018. But something we discovered is that there's some really good jobs out there that these businesses are looking. There's that missing piece in the workforce that, 25 to 45 or 50. I mean, we currently have a 62-year-old man in our program, but that's a missing piece of workforce. And so if we can provide some of those people to be able to get jobs, that fills the double need. So it fills it on the business side where they're going to get an employee that's going to show up on time because we're bringing them. We're drug testing them. They can drug test them. They're in a program that they're getting support. They're doing groups and recovery groups. So all those things that just add an extra layer to their recovery journey. And Sheriff Smith, we have some of our better residents come straight from jail and through drug court. So drug court in the state of Alabama has really gotten its game together. So they're offering some great programming for the guys. Their programming is 9 months to 12 months. And we're on their list that they can send them to us after they graduate from drug court to be able to have that next step that they need. There again, they graduate there. But then what are they going to do? How are they going to get a job? How are they going to get to their job? So all those things we've just kind of morphed together in a programming aspect and have had really good success. One piece of success we weren't seeing were, like I said, the jobs were really good. And we've had some guys that did not live in the Fayette area have come back and made residence there because they want to stay in their connected group. So they've got their recovery groups that they go to. And they also want to stay with a really good job that they've got and been able to build that portion of their life up.
I know you also work on the prevention side, even before somebody finds themselves in need of rehab. I mean, tell us about your advocacy there.
Sure. So once we started the foundation, we wanted to be multifaceted. So we didn't want to just focus on next step because we know, we want to do the prevention so you never have to come to us, right? So through the state of Alabama, we work with our legislators on getting what we call gas station dope, which is basically your phenibut, your tianopin. Those have now been classified as class 2 drugs, which is huge because they really one acts like an opiate and the other acts like a benzo. So, you can just walk in a gas station and buy it. And people were majorly getting addicted to these, even people that in recovery. You go to the gas station and you just go buy that and you get your little bit of high because you can get it, it's legal. So the state of Alabama has really been moving forward strongly on groups of us. We're the faith-based recovery ministry group, and we represent about 4,000 beds across the state of Alabama. And we've just joined forces, which has been very powerful to get legislation on these type drugs and get them banned from places that young adults can certainly go in and purchase. That's one piece. And on a national level, we are charter members of a group called Voices for Non-Opioid Choices, where we attach and look at legislation that is introduced to Congress and help them push it forward. So in 2023, our first piece of legislation was passed, and it's called the No Pain Act. And it basically will cover non-opioid pain management through Medicare as it would an opioid. So you have a choice if you're going in and you need to get a surgery and you really don't want to go the opioid route, but you may not have $300 to get a shot to numb the pain for 72 hours. So you may have to go the opioid route. So we were very excited to get that passed. It was a bipartisan across the board's effort, with over 80 congressmen and senators signing on to our bill. So we're very grateful for that. Our next step is to be able to push it down through the Veterans Association, because we know that's a group that's highly addicted, and some post-traumatic syndrome issues going on as well. And then eventually down to private pay. So those would be our two biggest groups that we really advocate for. There's some local groups that are here in our school systems that we definitely support as well. We're finding you need to probably start in early middle school because it's there. It's so available now, and social media stirs it as well too. But those are two big pieces that we're proud to say that we're a part of, and we're pushing good legislation because it's got to start at the top. We've got to have that leadership that's going to reflect what we want to happen down here in our local communities.
Mm-hmm, mm-hmm. Sheriff, let me ask you, has the rise of opioids and fentanyl had a practical impact on your deputies' day-to-day work? I'm thinking about whether they're carrying overdose reversing drugs as part of their standard equipment, or if they've built relationships with facilities where they might take someone in crisis.
Well, again, and Lisa knows this too, being in a small community, we don't have the resources that the big cities have. So we have to triage everything here. All the deputies, of course, carry Narcan, and now we're also carrying OpV, which is another new preventive tool that's out there. So all the deputies have that, of course. But what we like to do is kind of what Lisa's program's doing, but we do it from a sheriff's office perspective. The care coordinators, if there's someone who wants to go to rehab, we have like Oxford House. I'm sure y'all are probably familiar with Oxford House. That has been our success because we'll have people that are transitioning from jail straight to Oxford House. And of course, we do the same thing. Our care coordinators help them get a driver's license. We put money in their pocket. We put clothes on their back. We put food in the house for the first week so they can get stabilized, just like what Lisa's talking about. And a lot of these people that we're sending there, we all grew up with them. We all know them. So it's a lot different than being in a city. So the deputies have relationships with everybody that's in jail. I mean, we all know them. We know their fathers. We're just like one big family, even though we're not related by blood. So we know these people. So the deputies on the street, they know what's available here. They know how to approach people and try, let them know that it's available. And if that answers your question,
Yeah.
about, what the deputies do. But I mean, we also we let people know, and they come like, if you want to get help and you're not in jail, just walk in the door. We're going to help you.
Mhm.
Or, we're this is like an emergency room right here. Just walk in the front door, tell us you want to get help, and we'll help you. Or call us on the phone and we'll come pick you up. We want them to know that, but we also want them to know that if we catch you with drugs, you're going to be in the back. But if somebody walks in here with a pocket full of dope and says, hey, I want help, then we're not putting them in jail. We're going to put them in rehab.
Yeah.
So I think the community knows that. It's taken us a while to build up that reputation, but I think they do know that. And we talk a lot about rehabilitation. I mean, our care coordinators who are being staffed. So fortunately for us, we have a managing entity that, you may not know what that is because I don't know what it is in Alabama or in DC, but it's an entity where federal money comes down to them for mental health and substance abuse, and then they help. They get a third parties that provide these services. Well, they fund 2 positions for me that I call care coordinators, and those are the people who are working with these addicts and folks with mental health, or just like a guy at the restaurant last night that's Mexican and said he needs a driver's license and doesn't speak English. Well, the care coordinator is going to go help him get a driver's license. Now, he's not addicted. He's got a job, but we try to touch everybody that we can to help them maneuver the red tape of government, because that is what keeps people from being successful in rehab and a lot of other things. They can't maneuver all the bureaucracy to get it done. So we try to cut down on that. But thank goodness for NW Health Network, who gets these funds and funds these positions for us. We have, like I said, I have 2 positions. When we were doing it before we had those, I mean, I'm sitting here with my chief deputy and major of patrol operations, they would be doing it. Or Deborah, my chief of staff, she would be doing it. And they couldn't do their job because they were out taking Mr. Brown to get his driver's license, or going to look at Miss Brown's porch that was falling in and stuff like that. So now the care coordinators are doing that stuff for us. And it's, I know NW Health Network covers 18 counties in Florida. And now, since we started with this care coordinator program, I think with the exception of 2 or 3 counties, all 18 of them are doing the same thing.
Mhm.
And we've realized that the federal government is not going to do a lot to help us. They talk a good game, but they don't do a lot. And the state government is doing a little bit more, but not quite as much. I mean, I tried to get some funding this year in the legislature to build a mental health dorm. My jail's 40 years old. And when it was built 40 years ago, it wasn't built for what we're seeing now, all the addiction, all the mental health issues. And everybody that's in jail just about has a mental health issue. Some of them are so severe, I can't put them in general population because they have an addiction and a mental health issue. And I need a special place to put them so that they can be protected from themselves and from other inmates. But I didn't get the money this time. So we'll continue to deal with that issue. But that's a big issue that is probably going on everywhere. It's not just here.
Yeah. So let me ask both of you then as we start to wrap this up. We've got a lot of state legislators listening into this conversation, and our sort of whole mission is to communicate with state legislators. Lisa, as you're talking to lawmakers in Alabama, lawmakers in DC, any lawmaker around the country who might come to you and ask for solutions? I mean, what are you telling them? What do the states need to do to better support groups like yours and the people you serve?
I think one of the first topics that I would discuss with them, it would be broader than just the state view. I think we've got to control our borders better. So the pouring in of fentanyl primarily coming through our southern border is not helping our situation at all. I think on a local level, from the state of Alabama, we're trying to address things as they come to us. So, speaking of Narcan earlier, which is primarily used for heroin type overdoses, but what they're discovering with the fentanyl, it's barely touching it. So you've got to either do multiple doses of a Narcan or be able to have approved anything that's FDA approved for to stop overdose. So those are steps that I think legislatures can make sure they get pushed through. If they're approved by FDA and they're going to work better on someone overdosing on fentanyl, then we need to make sure our first responders have that. I think detox is a huge issue, at least in the state of Alabama. We don't have enough detox beds that people are detoxing on their own, and a lot of them are dying. You may wait 5 to 7 days to 2 weeks for a detox bed. Chances are you may not make it that long. If you're to that point where you're ready to get help, you need to be able to get help quickly. So those are some at the very end of your stage of addiction. Of course, we can always do more on the preventative side, but I'm like Sheriff Smith. They talk a good game sometimes, and then I mean, I'm a politician myself, but on a much smaller level in a city council role, and I understand how long it takes to get things done and passed, which is very frustrating because I like to get things done quickly. But it's something we've got to really address. We're losing an airplane full of people every day, and it's not getting noticed as if it would if it really was an airplane full of people. So those would be two things that I pay attention to: what FDA is passing and making sure every state has the options of those medications for reversing overdose, and also just making sure there's more detox beds available for those that are ready to get into recovery.
Gotcha. And Sheriff, how about you? What's your message to state lawmakers? What do they need, or what do you need from them to support your work in your community?
Here's what I want state lawmakers to do: close the drug houses, pass legislation that's going to make it tough on people who are selling drugs. Just like Lisa said, close the borders. We know from our investigations in little old Franklin County that we have tracked the drug flow from Mexico to California to Atlanta to here. And that's working with our federal partners, but that's got to stop. And until it does, it's going to continue, just like Lisa said. I mean, a plane load of people every day, that's a lot of people we're losing. And one is too many.
All right, Sheriff A.J. Smith from Franklin County, Florida, and Lisa Bright, the Chief Executive of the Will Bright Foundation. Thank you both so much for sharing.
Y'all. Have a great day.
Thank you so much. Thank you.
Bye-bye.
And folks, thank you all for joining today. This is a conversation that I know is happening in a lot of legislatures all over the country. So I'm happy we had it here too. Please make sure to follow along as we hold future conversations like this. You can find all of our event announcements in our morning newsletter, which you can sign up for free at pluribusnews.com. But thank you for all for being a part of the Pluribus News community. We'll look forward to seeing you again very soon. Until then, I'm Reed Wilson. I hope you have a great rest of the week.